Tardive dyskinesia, or TD, is a movement disorder. TD affects about 25% of people who take antipsychotic drugs for a long time. It's important to note that antipsychotic drugs are used to not only treat psychosis, but a variety of other mental health conditions like schizophrenia, bipolar disorder, and depression. These drugs work by blocking the neurotransmitter dopamine, which helps with many mental health problems and coordinates skeletal muscle movements to make them smooth and fluid. Sometimes, when there is too little dopamine, it can trigger an adaptation that makes some brain circuits become hypersensitive to dopamine and causes involuntary, abnormal, and repetitive movements of the person's face and body. This is what we see in TD. For someone with TD, these movements can be hard or impossible to control, causing them to feel embarrassed or uncomfortable. Some people may stop socializing and isolate themselves to avoid this embarrassment. Others might stop taking their medicines as prescribed. And there are people who have felt so desperate that they wanted to kill themselves. The longer someone takes antipsychotic medicines, the greater their chances of getting tardive dyskinesia. The good news is that newer antipsychotics appear to have much less chance of causing TD, and TD may be temporary, particularly in younger people if the antipsychotic medication can be safely stopped. That's why it's important to encourage your patients, their family, and caregivers to report any changes in their movements or how they feel. Monitoring for TD should be done informally at every visit with a provider, and with a simple rating scale at least every 6 months. That way you can make the necessary medication changes to ensure people are healthy and happy. If you suspect one of your patients has tardive dyskinesia, visit ADAA.org for free resources and use the search bar to access the Impact Tardive Dyskinesia or Impact TD scale.